Why taking antibiotics without a prescription can do more harm than good. Hello, my dear friends. This is Dr. Charles from PatientCareLinks, where we share practical health lessons drawn from real cases we see every day. Behind many cases of infections that refuse to improve, prolonged illness, severe diarrhea, allergic reactions, and medicines that no longer seem to work, there is sometimes a much deeper problem quietly developing within the body. A problem that affects the bacteria, the immune system, the digestive system, the liver, the kidneys, and even the future effectiveness of life-saving medicines. Today, I want us to explore a habit that has become increasingly common in many communities, taking antibiotics without a prescription. Many people have done it. A sore throat develops. Someone recommends an antibiotic left over from a previous illness. A cough lasts for a few days. A friend suggests buying antibiotics from a nearby shop. A fever begins. Without knowing the cause, antibiotics are started. At first, it may seem like the right thing to do. After all, antibiotics have helped many people recover from bacterial infections. But not every illness is caused by bacteria, and not every antibiotic is the right one. Sometimes the medicine is unnecessary. Sometimes it is the wrong choice. Sometimes it delays the correct diagnosis, and sometimes it creates a much bigger problem for both the individual and the community. That is where the real story begins. One of the most important lessons in preventive health care is that misuse of antibiotics often starts with good intentions. Someone develops a runny nose, a mild cough, a sore throat, body aches, a headache. Because these symptoms are uncomfortable, many people believe antibiotics will help them recover faster. But many of these illnesses are caused by viruses. Antibiotics do not kill viruses. They do not treat the common cold. They do not cure influenza. They do not treat most viral sore throats. Yet the antibiotics are taken anyway, sometimes only for 2 or 3 days, sometimes at the wrong dose, sometimes shared with family members, sometimes purchased without professional advice. Although the symptoms may improve naturally, people often assume the antibiotic was responsible. The habit is repeated the next time illness occurs, quietly, gradually, without realizing the long-term consequences. Antibiotics are medicines designed to kill bacteria or stop them from multiplying. When a bacterial infection is present, they can be life-saving, but bacteria are remarkably adaptable. When antibiotics are used incorrectly or unnecessarily, some bacteria survive. These surviving bacteria learn to resist the medicine. Over time, they multiply. The next time an infection occurs, the antibiotic that once worked may no longer be effective. This is known as antibiotic resistance. Now observe the biological domino effect. Antibiotics are taken when they are not needed. Sensitive bacteria are killed. Resistant bacteria survive. They multiply. Future infections become harder to treat. Stronger and more expensive medicines may be required. Hospital stays become longer. Complications become more likely, and infections that were once easy to cure may become life-threatening. Antibiotics can also affect the healthy bacteria living in the gut. These beneficial bacteria help with digestion, vitamin production, and protection against harmful germs. When they are disrupted, diarrhea, fungal infections, and other complications may occur. The body is not simply reacting to a medicine. It is responding to changes in its natural balance. From the medical perspective, the first step is identifying what is causing the illness. Is it bacterial? Is it viral? Is it fungal? Could it be an allergy or another medical condition? Doctors use the patient's history, physical examination, and when necessary, laboratory tests to determine whether antibiotics are appropriate. When antibiotics are needed, choosing the right medicine, the correct dose, and the proper duration is essential. Equally important is knowing when antibiotics are not needed. Good medical care means treating the cause, not simply prescribing medicine. Now bringing the nurse in perspective. Nurses play an important role in helping patients understand how to use antibiotics safely. Patients should be encouraged to take antibiotics exactly as prescribed. Complete the full course even if they begin to feel better. Never share antibiotics with another person. Never keep leftover antibiotics for future illnesses. Return for review if symptoms worsen or fail to improve. These simple steps help protect both the individual and the wider community. Now bring in the pharmacist perspective. Pharmacists help ensure that antibiotics are used safely and effectively. They explain how to take the medicine correctly, possible side effects, drug interactions, the importance of completing the prescribed course. Why antibiotics should never be taken without proper medical advice. They also remind patients that not every infection requires an antibiotic. Sometimes rest, fluids, and supportive treatment are all that is needed while the body recovers. Now bring in the dietitian's perspective. Good nutrition supports the immune system while the body fights infection. Drink plenty of fluids unless your healthcare provider advises otherwise. Eat a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. If antibiotics cause stomach upset or diarrhea, discuss this with your healthcare provider. Proper nutrition supports recovery, but it does not replace appropriate medical care, and illness begins. Antibiotics are taken without proper evaluation. The wrong medicine may be used. Healthy bacteria are disrupted. Resistant bacteria survive. Future infections become harder to treat. Complications become more likely. The individual is affected. The family is affected. The community is affected. The healthcare system is affected. This is why antibiotic resistance is considered one of the greatest public health challenges of our time. Because every unnecessary antibiotic contributes to a problem that affects us all. Antibiotics remain among the most important discoveries in modern medicine. When used correctly, they save millions of lives every year. Protect these medicines by using them wisely. Do not request antibiotics for every fever, cough, or sore throat. Do not buy antibiotics without proper medical advice. Do not share medicines with family or friends. Seek medical evaluation when symptoms persist or become severe. The right medicine for the right infection, at the right dose, for the right duration. That is how antibiotics continue to save lives. Protect your health, protect your family. Help protect the future of these life-saving medicines. Because sometimes the medicine we think we need is not the medicine our body actually requires. Patient Care Links. Call or WhatsApp +2332087200347